Sure. So our presentation at this meeting is on the combination of Zanubrutinib, a next-generation BTK inhibitor, in combination with Obinutuzumab. Now, this is a phase 1b study done in patients with a variety of histologies, but the largest group were patients with CLL and follicular lymphoma, and we presented in updated results. What we found was that the combination was actually quite active. Not surprisingly, in CLL, there was a very high response rate and a complete remission rate of 30%. And a lot of that is probably due to the Obinutuzumab adding to Zanubrutinib efficiency. But what we were particularly excited about is in follicular lymphoma, where we have a response rate of above 70% and a CR rate which is approaching 40%. To put this in context, Ibrutinib as a single agent has been tried in follicular lymphoma in a large phase 2 study where the response rates were substantially lower, with an overall response rate of 21% and a CR rate of 11%. Now, how much of that is due to Obinutuzumab and how much of it is due to Zanubrutinib, we don't really know, except that we know that single-agent BTK inhibitor in the shape of Ibrutinib and single-agent Obinutuzumab from the earlier studies are not really that active. So here we have a combination that is quite easily given, has very few adverse events, and really at the sort of response rates we're talking about, we feel is a real viable option for patients with follicular lymphoma.